During the first half of the 20th century, life for people with hemophilia was at best miserable. Usually disabled before the age of 20, life expectancy for these people averaged 27 years because of early deaths, often from bleeding into vital organs. Because of the improvements in transfusion technology made during World War II, people with hemophilia could receive infusions of fresh whole blood or fresh frozen plasma containing the missing clotting factor. As a result, life expectancy for a person with severe hemophilia reached 39.7 years by 1960, but the crippling effects of repeated bleeds left a substantial portion of the population disabled and unemployed. Those were the circumstances when Mary Gooley started working in hemophilia. Families in the Rochester Hemophilia Society, which had its genesis in the late 1940s and was formally chartered as a chapter of the National Hemophilia Foundation in 1953, were seeking better treatment options. They wanted better lives for their children. They turned to Mary Gooley for help, and the center began treating people in 1959. In fact, our center was the first freestanding hemophilia center in the U.S., offering comprehensive care to people suffering with hemophilia. Over the years, the center expanded its role to treat people suffering with other genetic bleeding disorders like von Willebrand disease, various factor deficiencies, as well as hemochromatosis or iron overload, and Gaucher disease. Ask Mary, and she'll be quick to tell you that none of this could have been accomplished without the help of Rochester General Hospital, the Rochester Red Cross, the Community Chest, now known as United Way, the steadfast support of patient families, and later Blue Cross of Rochester.
Hi, I'm Mary Gooley, and as I thumb through this album, I can't help but be thrilled by the advances I have witnessed in the treatment and care of people with hemophilia over the years.
But sadly, the pooling of blood to make freeze-dried concentrate also led to the darkest time in hemophilia history.
So people were taking these blood products to treat their disorder, but they were being infected with these viruses. And the devastation that followed was horrendous. Families were changed forever. Many people died. More than half the population of males with hemophilia got the HIV virus and contracted AIDS and subsequently died. Terrible tragedy.
The Mary M. Gooley Center is celebrating 50 years of treatment. We're concentrating on the progress we have made, but we must never forget the troubled times, the AIDS pandemic, and those patients whom we lost. For 50 years, the comprehensive care model as practiced at our center has played a vital role in improving the lives of our patients and their families. In addition, it has served as a model for other medical centers. The concept of comprehensive care embodies caring for the whole person, even the entire family, not simply treating the disease itself. Comprehensive care is central to serving the physical, emotional, social, psychological, and educational needs of every family dealing with a bleeding disorder. Assembling a wide range of professionals with specialized training in a variety of disciplines allows us to deliver skilled care management to our patients, including accurate diagnosis, prompt and effective therapy, fewer hospitalizations, fewer serious disabling joint problems, counseling support, and advocacy on their behalf. One component of comprehensive care is the periodic comprehensive care clinic patients attend at our center, a one-stop shopping experience for people with a bleeding disorder. We assemble many specialists together so that patients in one day see their hemophilia doctor, a nurse, social worker, physical therapist, orthopedist, dentist, and as appropriate, a pediatrician, nutritionist, or geneticist. And it's all coordinated by the center. Comprehensive care has been shown to be efficient and effective. It works. This is the way all health care should be delivered. We know that exercise strengthens joints and helps to prevent bleeding episodes, so we offer camp experiences for our boys and opportunities to exercise. We also hold our annual Finger Lakes Triathlon, not only to raise money for the center, but to raise awareness of what we do and to encourage healthy lifestyles. We're extremely proud of our young patients who have trained for and completed the Kids Triathlon. Today, preserving healthy joints and preventing complications from inhibitors are our greatest physical concerns. The inconvenience and discomfort of bleeds and infusions persists, but today, factor products are safe and effective. However, they are extremely expensive. Clotting factor for an adult with severe hemophilia costs an average of $150,000 per year. Obviously, maintaining health insurance coverage is essential to families with bleeding disorders. For the center, health insurance reimbursement is critical to our ability to provide comprehensive care to all patients. In this environment, our work is cut out for us. We must promote research that will lead to advances in the treatment of people with bleeding disorders. We must support the National Hemophilia Foundation in their efforts to find cures. We must advocate to preserve comprehensive care and access to clotting factor. Our mission is to provide means to improve the lives of people affected by bleeding disorders and iron overload. We've come a long way over the past 50 years, but as long as we have patients who need our help and support, we will continue the legacy begun by Mary Gooley. Caring is in our blood.